Hey Kelly, how are you?
I'm all right. How are
Good
you?
to see you.
Good to see you too.
So we're 4 weeks and we're getting close to putting full weight on it. How we doing? Still touching down?
I think I might have screwed up. I think I started
A little too early?
Too early. I started with just one crutch instead of the two because I hate crutches with the boot, and I'm having a lot more pain underneath, and I don't feel like I can put weight on it unless I have the wrap on, and so I don't know if I started too early or
No,
if
I'm
it's just
smiling.
like it's taking its time.
Yeah, I'm smiling because you can't throw stones in a glass house. Because I do the same thing. You push the envelope. The good news is this is something that you can't screw up.
Okay.
I mean, this is one of these things where the bone integrity is healing inside of the ankle joint. We went ahead and we put all the biologics inside after we cleaned out the cartilage. It's going to get well over time. The analogy is kind of like a scuffed elbow. It's going to have a scab on it, but if you keep scuffing it over and over, it won't heal, but yours is not like that. Yours is more like it's healing. You're only 4 weeks, and touching down is all I wanted anyway, so you're good. And if you push too hard, and then you got off of it, it feels better, then there's that kind of easy thing to keep in touch with. You can play doctor where, well, I'll do a little bit and then it'll hurt that night, but if I lay off it, it's better.
Yeah.
As long as you don't re-injure it. The scar tissue on the bottom from your heel spur incision right here, the heel spur incision here, this is going to be kind of rubbery. So that whole band is underneath the heel here.
I'm having sharp shooting pain through there.
Exactly. And my funny comment.
Coming away.
And I said, well, it's smart. I mean, everything in our body's smart, even the scar tissue.
Where you were just touching.
Exactly.
It's like, and when it comes on, it's fast and it's hard.
Well, guess why it's purple? It has vessels in it to help you heal, and that's where the venous blood is ending up, and it has nerve endings to keep the big dumb Homo sapien off the cut. So that's my joke for patients because, it is hard. If it's on your hand or somewhere else, it would be easy. But here, you're putting all your body weight right here. So that totally makes sense.
And it makes sense, too, why it feels more comfortable to have the wrap and like that cushion right there as well as the boot. Because
Exactly.
It kind of
Exactly.
It's like my foot knows it's just not ready.
Did we make you a pair of these?
No, and I called
okay.
I called here, and I thought for sure that my insurance would cover it. They've been really good about everything else, and no, only a part. And I'm like,
we'll cross that bridge when we
I'm
get
like,
there.
whatever. I'm still in the boot right now anyway.
And you're still healing. But the good news is at 4 weeks, I'm giving the green light to go back to the shoe. So what will happen is by default, you'll put more pressure in the archway. Sorry about that. More pressure in the archway. Is it more sensitive there still too?
It really, that just really started this week. That's why I was worried that I did something.
Well, maybe it's a slight pull, but that's okay. Because when we release the ligament, we don't want it to reattach. So on that note, pull your toes upwards. We want to keep stretching the ankle upwards.
Okay.
Keep stretching this area. But I put a pad here because instead of pressure right on this area where the incision is, pressure here and here, it'll put more pressure into the arch.
Okay.
With the shoe, I think you'll do better in the house. With crutches, partial weight bearing. And then, 2 steps forward, 1 step back if you're having a good or bad day. And then the boot's usually more safe for when you go outside. So keep it simple. Boot when you go out, shoe when you stay in the house. I don't see you for a whole another month now, but I wanted to kind of show you your x-rays. They look great.
Good.
Everything's healing fine. The area here is...
What about this? I was telling Sam, so I've been flexing it right because it just feels like I should. When I pull back, it feels like something, like, not metal, but something is restrictive. Is that just because of, it's just got to kind of limber itself out, it's got to work itself out because of the surgery? It just feels different.
No. You're exactly the same thing that's going on the bottom of your foot. Now, what we did is we cleaned out the front, but for temporarily, I tell everybody scar tissue is like an angry adolescent. It gets that big, thick phase where it's just kind of healing and it's talking to you, telling you to keep off it. And then over time, it matures and it gets thinner, less nerve endings. You'll clear the ground better. But right now, it's just a big wad right here stopping you from going upwards. That's it. It will go away.
Okay.
And that will help with your stretching too.
What about the weight? So I've been I was telling Sam, like, it hurt. I feel unsteady whenever I try to put any weight on it, unless I'm wearing the boot. Sometimes I'll get pins and needles underneath the foot, and also it'll feel kind of almost like kind of unsteady, like weak, almost like fragile.
Another
so
phenomenon.
In the shower, I'm not even putting weight on it.
No, that's normal. Another phenomenon, and I use the analogy of hot bowl of soup, because if you have a hot bowl of soup, right, the noxious pain goes to your spine and back, and you drop it.
Right.
So on this, you can stand it, but if you put enough pressure and pain on it, your leg will kind of give out a little bit. It's normal. Just be careful. Use your crutches. And over time, you'll gain confidence.
What about this back here? This feels kind of sore. It's almost like an internal bruise back here. Is that just kind of part of it too? Like all of that is starting to come to life.
As soon as you fight up with this big area of scar tissue here, and the whole wad starts to pinch, your Achilles tendon fires to push away from the pain.
Okay.
I don't like this, so I'm going to keep flexing. It overfires and it gets sore. So all that will go away, but it's all normal.
And the bruising
good questions.
Underneath the foot.
Yes.
I didn't even notice that before. Was it like that before? Was it bruising
No,
under there before?
no, it's gravity.
Okay.
And it's funny because if you lay in bed all day, the bruising will be like back here. If it's down, it'll all come to the forefoot.
And I've been trying to move. So.
Yeah. So I've had patients call me like, "Whoa, what's going on here?" And I just say it's gravity.
I mean, it's a pretty color, but I noticed that the other day in the shower. I was washing my phone.
Yeah.
Wait, was that? I don't remember that being there.
Yeah.
But it's kind of to a point where now I feel like I'm definitely more mobile. I feel like I am pushing myself because honestly, I'm tired. I'm ready to start being able to walk grand dog and stuff. But every couple of hours, I'll get those shooting pains, and I'll need to elevate my foot so it'll stop. So that's normal.
Yes.
So just listen to it.
Yes. You will get there, and I am a terrible injured person too. I've been there.
I'm not patient.
Oh, because you want to go on tomorrow.
I pushed like everybody a couple of weeks ago. I was just like, no, I'm so sorry. I know everyone's trying to help, but I just need everybody to just back off and let me do this. I might be miserable for a little bit, but I'll get past it.
Yes, ma'am. In week 6, you're going to be much better.
Good.
It's 2 more weeks. Week 8, you're going to probably come walking in here with a full shoe on. Just hanging
really
there.
Cute high heels. I just can't wait to wear them again. I know that sounds weird. Most people are like, oh, I'm going to flip-flops. I'm like, I need to get back in the heels. They're cute.
No, especially the cosmetic stuff I do. My goal is to get you functional and also back into the shoes that you want to for fashion. Oh, you can do a pedicure now. Just, the obvious stuff.
Like don't rub it.
Don't let them massage too much. But a little massage on the scar tissue is good.
Oh,
and I can't believe you came in with these nails like this. Oh, my God.
They've been like that. I'm like, I feel like,
Don't get your pedicure.
Do another pedicure, I was like,
that's a priority.
My daughter was saying last week, she's like, I've never seen you with naked toenails. They're always painted red. I was like, just don't feel like painting them. And I can't get a pedicure yet. So.
Yes, you can.
Good. Maybe I'll go get one this weekend. You're like, please don't.
Those
nails looking like that again.
last visit, the stitches came out. And you got to get it wet. This visit, you get the pedicure, and I think you're going to really advance quickly. Of course, I'm always here if you need me. Otherwise, 2 steps forward, 1 step back. Okay.
So whenever you went in there, I just want to recap.
Yes, ma'am.
What did you take the bone spur that was there, or did you just kind of file it down?
Yes, ma'am.
Okay.
Yeah, you can see from the earlier picture that right here, you can have beforehand. You can see the spur down here.
That good-looking thing.
Yeah, and then afterwards we release the ligament. It's really not the spur, and we plane it off, so the spur is gone. But more importantly, what you're having done is over here. We're releasing the ligament right here. But while we're down there, we go ahead and bevel that off, and then we take a small piece so it won't reattach. You don't need the ligament, but to hold your arch up. But that pulling pain when your foot flattens out is going to be gone. That's what seems like an aggressive procedure, but it really works well. And then this is, like I said, what we cleaned up in your ankle joint. But yeah, tick-tock, tick-tock.
I mean, considering everything you did, I'm really surprised that I'm not in more pain after 4 weeks. I do have to say, that has been surprising. The hardest thing is here. Like getting it through my head, like sit, stay.
Tick-tock, tick-tock, tick-tock.
Yeah, that's the hardest part.
Oh, and you have to get around, too. There's that, too.
Yeah, but one more question.
Yes,
I'm down to 1 crutch because, I wasn't very good on them anyway. I even though it's this foot, I feel more comfortable having this crutch under this arm. And someone told me I looked like I was faking it because I didn't have it under this arm. But I feel like I put less weight on this when this crutch is under this arm. Does that make sense, or does it matter?
Critical mass. Critical mass means whatever kind of force you put on that foot, however you balance on that thing, whatever arm, it doesn't matter.
So, but no heels though. Even if I'm feeling it in another month, I can't. I shouldn't.
Say in a week or two, you want to put them on in the morning, brush your teeth, cruise around, and say, "Oh man, that hurts."
Yeah,
well, no
it
kidding.
will.
If you get around, you're like, "Well, I can do this." Yeah, go ahead and go to church or do whatever. Take your boot with you in case it starts hurting. But it's always wading into the shallow, and you'll know. But you try them out. I mean,
I don't want to do it right now, but like in a month, I'd like to be able to do it again.
Ironically, for year 2 procedures, which was ankle and heel, when you go up on your high heels, you'll be putting more pressure on the balls of your feet. So theoretically, they could feel okay in a week or two. Okay? Try it out. Don't push too hard.
I won't. I really won't. I don't want to go back. I'm ready to just move forward. So.
Great.
Awesome. Thank
All right.
you.
See you in a month.
Yes, sir.
Be good.
Have a good weekend. All right,
Yeah.
bye.
Take care.